Lameness Workup AGRI 1217 by Eloise Dubrow. The horse being evaluated in the following video is named Loco. She is 7 years old, a sports horse standing at 15.3 hands high. She is a mare who competes at novice level dressage. First, looking at the horse's static conformation, one can see that according to the British Equine Veterinary Association Guidelines 2016, the horse has a body condition score of 3. The coat and skin appear healthy overall, however veterinary notes are needed to confirm the absence of skin ailments and conditions. Conformationally, when looking at the horse as a whole, the horse is divided into 3 sections: hindquarters, back and chest. The chest and hindquarters look to be a similar size, with the back being slightly longer than the other 2 sections. This is typical of mares as they require a larger internal space to carry foals according to literature by McKinnon et al. 2011 and Johnston et al. 2004. The neck is set on slightly high from the point of shoulder, which is the top of the humerus at the junction with the bottom of the scapula. The head appears to be a good size in proportion to the rest of the body, as are the ears, eyes and nostrils, which are a good size in proportion to the head. From the cranial view of the forelimbs are straight and do not bend at the carpus, which suggests that the chest size is appropriate for the size of the horse. The hooves are to a small degree toe out. The carpus was palpated and found to be flat and smooth, with no bony enlargements. The forelimbs are camped out behind, as is seen in this lateral view photo. The hoof pastern angle appears to be the correct conformational angle of 45 degrees for the forelimb. However, the angle of the scapula is steeper than the hoof pastern angle of the forelimb. To be conformationally correct, the angles should be proportional to one another. This may negatively impact the competitive success in dressage horses, which is considered an important conformational trait in the protraction and retraction of the forelimb, controlled by the shoulder joint, as conducted by research from Soleil et al. 2013. Back length is a crucial conformational trait in dressage horses as it controls lateral movement, spinal stability, muscle flexion and locomotion, as found by Walker et al. 2016. The horse is higher at the withers than the croup, which may be difficult to find a correct saddle fit, increasing the likelihood of injury to the withers. The dorsal curvature of the back, however, is correct and is not roach or sway backed. The hind limb appears straight when examined from the line touching point of buttock or tuba ischii, as it does not match the patella of the tarsus. This could predispose the horse to injuries in areas such as suspensory ligaments in the hind limbs, as conducted by research from Marnery et al. 2014. The horse has a good hind limb conformation in the angle from tuba coxae to tuba ischii and the top of the stifle, forming an equilateral triangle. The hoof pastern angle is upright on the hind limb, as it appears more upright than a 55-degree angle. On the posterior view of the hind limbs, the horse is slightly cow-hocked, but this is common in all horses to some degree. The hooves, similar to the front limb on the hind limbs, are toe out. The handler was instructed to walk the horse in a straight line, with a straight head carriage to examine the horse for any clear head vertical displacement at walk and trot, which could indicate forelimb lameness. The distance walked was roughly 20 metres to allow for enough strides to accurately determine lameness and allow for a straight line. There is no evidence of a head vertical displacement increase on either forelimb in the walk videos, showing no signs of irregular gait at walk. Additionally, there are no audible sounds of lameness such as a toe drag, although there is a louder sound when the left hind limb lands, which could suggest asymmetrical weight distribution. Yet, the posterior view during the walk-up show both hips symmetrical in their rise and fall. The horse appears to be walking on 2 tracks, not dishing or plaiting. Furthermore, the horse has a good 4-beat rhythm. In the lateral view of the walk-up, a symmetrical fly arc in both the front and hind limbs are seen, and the horse appears to be over-tracking at walk. The handler was instructed to lengthen the area the horse would use to allow the horse more space to transition from walk to trot. No vertical head or hip displacement asymmetry is seen. There are no audible signs of lameness or clear signs of pain. The horse has a correct 2-beat rhythm. In the lateral view of the trot, the forelimb radius and hindlimb cannon bone are parallel, and the horse appears to be tracking up. When lunging on a soft surface on the left rein, at walk, the horse has a relaxed gait with a good head carriage. The horse continues to overtrack at walk on both the inside and outside limbs. No shortened stride, head or pelvic vertical displacement asymmetry is evident during trot on the left rein. Similarly to trot up on a hard surface, the horse tracks up in trot when lunged on a soft surface, again on both the inside and outside limbs. There are no clear signs of pain or uneven gait seen at trot. During canter, a smooth rolling gait can be seen with no signs of pain or lameness. Walk is sound on the right rein when lunging on a soft surface similar to the left rein. The horse has no signs of pain at walk and has a relaxed gait. Furthermore, the horse overtracks in walk on both the inside and outside limbs. At trot, the horse tracks up, similar to other dynamic conformational videos as seen earlier, with no stiffness or uneven gait. At canter, similar to the left rein, a rolling gait can be seen with no signs of pain or lameness. A clear 3-beat rhythm can be established. When lunging on a hard surface, walk shows no lameness. The horse's behaviour seems relaxed with no visible signs of pain. Similar to exercising on a soft surface, the horse tracks up at walk. Trot has a shortened stride compared to on a soft surface, yet similar to other dynamic conformation videos, the horse tracks up in trot. Canter was not attempted on a hard surface due to ethical implications of canter on a hard surface being painful for the horse. Walk appears sound on the right rein with no head or pelvic vertical displacement asymmetry. The horse looks alert with no signs of pain or lameness. Once again, the horse overtracks in walk. However, at trot, the horse undertracks on the right rein. This could indicate lameness. Trot appears stiffer than the left rein on a hard surface and to have a shortened stride compared to lunging on a soft surface. The hind right leg appears to be slightly lame due to the increased loading when exercising on a circle, researched by Grieve et al. 2017, with possible contralateral compensatory lameness on the left forelimb. In summary, following this lameness workup, the horse appears sound.